The following segment sponsored by Bristol Plastic Surgery. Skin cancer is the most common cancer in the United States, with over 9,500 people diagnosed daily, but it is very preventable. And this morning we want to welcome Dr. John Bandeian from Bristol Plastic Surgery, along with his patient, Penny Vires, to Daytime for a discussion of prevention and treatment of skin cancer. Good morning.
Good morning.
Good morning.
Thank you all for being here.
Yep.
And doctor, at the base, skin cancer is preventable, isn't it?
Yes. I'm talking about basal cell and squamous cell skin cancers, which are the most common types. I believe that they're almost 100% preventable with the use of a medicine like Effudex or Aldera, or a blue light treatment that dermatologists use. Now, Penny has been my patient for 6.5 years. In the 11 months before she became my patient, she developed one cancer after another. And 2 of them were removed with Mohs surgery, that's spelled M-O-H-S, and the results were quite disfiguring. And then she came to me, and I removed one from the right side of her left side of her nose. Right. And it was a straightforward procedure. You can see that.
Yeah, we're looking at those photos right now.
Yeah. So anyway, she's had an excellent result from just cutting it out. That's without Mohs.
Without Mohs.
She had one on her right cheek that I treated with Effudex.
Okay.
So, and then she had a cancer on the right side of her nose that was initially treated with Mohs, and that came back, and I cut that one out. So that hasn't come back. But the point is, every year since I first saw her 6.5 years ago, she's used Effudex treatment on her face. And she has not had a single new skin cancer during that time. And yet, in the 11 months before I saw her, she developed 3 new skin cancers. So Effudex is an extremely effective treatment, and it's cheap. If you don't have insurance, you can get it for about $65, $70 using GoodRx. I've prescribed this on literally thousands of patients over the years, and no one has ever had a side effect. If you don't need to use Effudex, it doesn't do anything. Right. But if you need to use it, you'll get red spots everywhere there's a precancerous growth or a cancer.
And Penny, for you, how satisfied have you been with this treatment with Dr. Bandeian?
Well, I have certainly been satisfied all the way. Never had a problem after I went to Dr. Bandeian, and he has helped me do correct the Mohs surgery that I had done.
Right, you'd had Mohs before.
Reconstruction on my forehead, and then on each side of my nose. So he treated me for that and did the reconstruction after I had the Mohs surgery. Right. But using the Effudex, I have not had any problem at all since I've had, this surgery done, and using the Effudex, I'm perfectly fine. Hadn't had any reoccurrence at all.
And it's great for your practice at Bristol Plastic Surgery that you have these success stories like this, isn't it?
Well, thank you. But I do not charge my patients for prescribing Effudex because I think it's my ethical duty to treat them. But I also like to point out, you don't have to be a plastic surgeon or a dermatologist to prescribe this. Patients can ask their primary care doctors to prescribe it. And as I say, it's extremely safe.
Extremely safe being 2 key words that a lot of folks, those patients like Penny, want to hear.
That's certainly true.
Yes, and when you want something that is extremely safe. And we were talking about the preventive side of things. What can folks do to prevent skin cancer?
Well, the main thing is stay out of the sun and use sunscreen.
As much as possible.
Yes, but once you've had a lifetime of sun exposure, the damage is already done. Sun damage is progressive. So at this point, your option would be to either get skin cancers or use something like Effudex, and you can prevent skin cancers from coming.
Now, is there any time when it would be prescribed to do the Mohs surgery instead of Effudex?
Sure. Mohs surgery was originally invented to treat cancers in difficult cosmetic areas like eyelid, lips, ears. and it's a perfectly acceptable procedure.
Right.
But it's been way overused, in my opinion, on non-critical areas. For instance, on the left, you see a hole above the woman's right eyebrow.
Yes.
And the picture on the left shows the same area 6 years later.
Right.
Now, she came to me with that hole above her right eyebrow.
Yes.
She had been scheduled for Mohs surgery, but she didn't want it. And I told her that there was no reason to do Mohs surgery because the cancer was probably cured with the biopsy, but and with Efudex using combination. And I said, if it comes back, it's a simple matter to cut it out. So the point is, 4 years later, it didn't come back.
Right.
She had no additional treatment.
Another success story.
Yes.
All right. Penny, last question for you. I wanted, for folks out there that may be thinking about going to see Dr. Bandeian, what would you tell them to do?
Well, I tell them that they cannot find another doctor that is dedicated to his profession as he has been over many years.
All right. All right. Very good. And Dr. Bandeian, you would love for folks, if they're having an issue, a skin issue of some kind, to come and see you, find out what they need to do as far as Efudex, Mohs. You will have the answers for them.
I do.
Penny, Dr. Bandeian, thank you so much for stopping.
Thank you, sir.
Today and
You're
sharing your
welcome.
stories. It was very informative. We appreciate it. Bristol Plastic Surgery. We have the information for you right there on the screen. The preceding segment sponsored by Bristol Plastic Surgery.